masks, and when do they reuse it, or when is it safe to reuse it?
Okay, thank you so much. So when we talk about the reusable mask, this is the one I talked about, the one made out of cloth. One thing to note is that when you use that mask, you are actually protecting others. You are not protecting yourself. You are protecting others because we know now with more evidence that is coming up that it's possible to transmit COVID-19 disease even when you don't have symptoms. So you can be what we call asymptomatic. This is where you have no symptoms, but you have the disease and you can transmit it. So most of the time when we are in the public out there, it's very easy to transmit the infection when you actually don't know. So the face mask is used basically to protect others, so that when you cough, remember we say the spread of infection is when you cough, sneeze, those droplets, they move. And if someone is in close proximity, they are able to inhale the droplets and then they can take the virus inside. So now when you put on the mask, basically you are preventing the spread of those droplets. So when one cough acts as a barrier, it prevents those droplets from moving. So when you are using that type of mask, the cloth mask, it's very important that you need to make sure you are using a mask which is not torn, which is not wet, and then after using it, it has to be washed. So there are two different types of washing that you can do. If you have a washing machine, you can put it in a machine, and it's advisable to use hot water because hot water kind of destroys the virus. If you don't have a washing machine, still you can use your soap and warm water, or water which is a bit warm, and then you wash. But what is important after washing is that you have to make sure it dries, and then it should be ironed. So when you iron, again, that is, because iron has heat, then you are destroying the virus also. So what is advisable is that you should at least have two masks, so that when you have washed one, then you have one that you can use here.
We prefer that the health workers need to use the correctly specified mask in the facilities. For the home use mask, there is some guidance that is provided, and some of the guidance is looking at the material that is used, how breathable this material is, the number of layers that you need in the material, also how much is able to repel water, and also the size of the mask and how well it fits. So all these are considerations that need to be taken in terms of the mask that people wear, in terms of the safety of the mask that people wear. Typically, in terms of the masks that are sold, if they are going to be masks that are sold, there will need to be some guidance in terms of quality from the expected authorities. But if people are making the masks themselves, then they need to look at some of these issues that we raise in terms of how breathable is the material, in terms of how much is able to repel water, and as we use it, how there are certain do's and don'ts of the mask using it, how well it fits you as well. So those are some of the considerations in terms of the safety of the mask and the material that is used. Thank you very much for that question. And the recommendation from WHO is that when we're talking about the spread of COVID, we are looking at it holistically, and we also look at it in terms of the risk. So for instance, for you to use any of the masks, we need to assess the risk. We talk about the medical and then the non-medical mask, and it's important that we use the mask according to the risk. For the health workers who are in the front line, who are taking care of patients, they are the ones most at risk. And we recommend that the medical masks are safe for the health workers. So the surgical mask that you mentioned, the medical mask, the face mask, the N95 mask, all of those masks should be safe for health workers and used in the health facilities. That is very important, because if we use them in the general public, what it would mean is that our health workers who are the front line will not have adequate masks to use. And in that case, you end up finding a health worker using something which is not as effective. And when that happens, when the infection spreads to the the health worker. We are all at risk, so it's important that the public saves the use of those medical masks for the health personnel. So I would recommend that the general public uses the cloth mask that he demonstrated. And with the cloth mask, we indicated that it's important that we have the correct guidance in terms of the way the material that is